In medicine, we use a lot of acronyms, and two that get confused very commonly are IBD, or inflammatory bowel disease, and IBS, or irritable bowel syndrome. Both conditions can cause abdominal pain and diarrhea. If I took a camera and I looked inside the colon of somebody with ulcerative colitis or Crohn's disease, I would see ulcers, inflammation, redness, bleeding. If I looked inside the colon of someone with irritable bowel syndrome, it would look completely normal. Ulcerative colitis falls into the category of IBD, or inflammatory bowel disease. We have a few treatment goals when we start medicine for your ulcerative colitis. One is clinical remission. That means that you feel well without symptoms of your ulcerative colitis. I want you to be able to go about your day-to-day life feeling like you never had this diagnosis. Number two is I want you to be in endoscopic remission, meaning that when I take my camera and look again in your colon, I want that colon wall to look like you didn't have inflammation before. I want it to look like a normal colon wall. The other thing that's really important to know is that we can heal your ulcerative colitis, but you may still have some symptoms, and those may be more toward an irritable bowel syndrome kind of picture rather than ongoing inflammation. A lot of people have an overlap of both, and especially when your colon heals, your colon might be hypersensitive after all that time being inflamed. That brain-gut axis is sort of off kilter because you've had chronic inflammation for a long time and your gut is more sensitive than it might have been otherwise. And the brain is giving the gut signals to feel pain or other symptoms that are not actually due to true damage to the wall of the bowel. And so you're getting symptoms like bloating, abdominal pain, diarrhea, constipation, which is very surprising for ulcerative colitis patients who have been dealing with diarrhea for all this time. And there are a lot of ways that we can manage that, both with medication and with different behavioral therapy, with nutrition, with sort of a toolkit that we can create with a lot of different ways to address those symptoms, even when your inflammation isn't the primary driver anymore. And so it's important to know you may not have complete perfect fix of your symptoms even when your inflammation is resolved.